care for children for school-age children, and working with partners in their communities that are better positioned to provide care for children birth to 5. In some cases, the care for 3 and 4-year-olds may very well happen at the school building level. School districts that are OPK Head Start grantees or that have co-located Head Start programs, for example, are well positioned to provide that care. School districts that are preschool promise sites, school districts that run their own preschool program. There's no reason why they can't continue to provide care for 3 and 4-year-old children. Where that's not the case, finding other providers in the community who can meet that need is going to be essential. So that's kind of the background on why we've said only school age. It's a bit of a both and.
Thank you, Brett. I feel much better about that.
See a question here about chains of communication and other public agencies providing care for emergency responders. Not sure what our role would be in that. Margie, I wonder if this is one that you could take.
Absolutely. Other public agencies providing care for emergency responders. So what we're trying to do is get out into the community and actually creating a communication about them enrolling in the NACRAWare database. So we really are trying to funnel this so that there's one place to go to enroll, to get into the NACRAWare database, so that as calls come in, 211 can provide these calls and sort accordingly. So the communication, there are a couple of things you may already know. TRI has set up their CCR&R helpline again, and it is staffed by an English and Spanish speaker Monday through Friday, 8 to 5. And so getting that number, that 800 number out so that people can call who have questions and say, how do I get enrolled? How do I get known to be an emergency child care program, so I can get referrals? They can hand it to you, so each of you. We are also, or they can update then and there, depending on their their capacity at the moment. So a couple of things happening. We are making sure everyone is getting all of your information. So by counties, this is your CCR&R. Here is the link to their website. And what I need all of you to do, if you could in the chat box give us your phone number. That is the contact number now. Like, what is that number that's going to get through to the person who can enroll in information to the NACRAWare database. So if you hear of these programs in your community, I would please ask them to talk to you, to call you. And Lisa, you had something. Did you want to say something?
Yeah, I was just going to say, for some of you, if you're not able to connect to your office phones at all, you might be putting a couple of remote phone numbers down as contact for this current time.
So all superintendents will get this information. Every school district will have it, Parks and Recreation, and we're really trying, it will probably be going out in a type of news release communication. I'm not too sure our communications department is going to do it, but we're getting, we're trying to get that sent out broadly. So
Margie, that was a question that I typed in. Can I just maybe clarify a little more? I'm having such a hard time focusing, like I think probably everybody is, but so it's a pretty concrete example. I haven't actually spoken to them yet, but one of our QIS has a husband who works for Park and Rec, and they asked me to call them and tell, like, they already have some plans going, but they want to know what we're doing and what our role is in it. So in that case, we just talk to them and get them in there and mark them as emergency childcare if they want to be. Is it pretty much that simple? Okay.
It is. I do want to mention, though, And John, this is where you probably want to step in. I'm thinking of the staff and them getting registered with Office of Child Care, because we have set up a process for that, which I'm still kind of fuzzy on how the schools are doing that. I think they're registering with the Office of Child Care, definitely. But there is a toolkit that John put the link in the chat box, and it's also in the message that went out last night or early this morning. There's a link to it. John, did you want to talk a little bit about that?
Well, sure, and Brett may know distinctly more about this part of our website, but it's definitely the place that you need to drive school districts and other emergency child care programs that would like to sort of prop up a new site specifically for this type of work to help emergency responders. And so when you go to that link, there's some pretty distinct things that they have to do. One is fill out a form that kind of registers that particular location or site with the Office of Child Care so they know it's existing. What we need to do on the back end of that is connect them with TRI to get it into NACRAWare as those things are submitted, and I think we've got a process for that. Programs like the Boys and Girls Club programs, there was actually some correspondence going back and forth with the governor's office and Alyssa Chatterjee with, I think, Boys and Girls Club, or sorry, Parks and Rec. I'm getting my wires crossed. It's coming from all sides, but Parks and Rec has been really trying to figure out how they can be a part of the solution across the state. And so Alyssa was giving them guidance, and I think it's important for you guys to think about this too, is sort of opening that toolkit is probably your best first step with anyone who's calling about, like, what do we do? How are we opening this up? Are you gonna help us make this happen? That toolkit is a good place to start, because it's like, it talks about the ratios, distancing of children, smaller group sizes, all the things that they should be sort of thinking about as programs if they're going to go down this road. So that could be school districts, that could be places like Parks and Rec, that could be the Champions school sites or YMCAs or whatever else. But they do want to register those pop-up programs through that link at the Office of Child Care, or on the ELD website. And then I think the other component here is that people are trying to pop these things up and they don't necessarily have all of the staff or employees to do it. I think school districts, and again, Brett can stop or correct me at some point if he would like, but I think school districts are sort of charged with trying to figure out what body of people they might be utilizing to do some of this work. And he mentioned all the kinds of things that school districts already operate that might contribute to them staffing some emergency care. But I think when they're partnering around birth to 3 programs, they're going to need a partner in the community that knows how to do this work, and that poses other needs for potentially having people who are trained and ready and have taken all of the proper trainings in order to be mobilized to do this work. And so the thing that I talked to you guys about yesterday, wasn't it? Or maybe it was earlier today. I don't even remember. But the point is we talked about it recently, and it was related to recruiting subs, recruiting people who will help as temporary staff, or people who might even want to be sort of in that kind of a nanny role, going to first responders' homes if they're working overnight and don't want to put their kids into a childcare program through the middle of the night. We are going to be sending out a link to that. That has not come out yet, but that will go out hopefully at the end of today through from our TRI partners, that will be going to all active ORO members. So anybody who is sort of attached to an early childhood site in Oregon, so about 17,300 people are going to get an email that says, we want to mobilize you to do care And what that's really doing is trying to focus on people who have probably been laid off, potentially are looking at contributing additional hours, people who are actually being paid to sit at home but want to get engaged. I mean, it's really a call to action. No one's required to do anything, but we imagine we're going to need some more bodies to get out there. And so it's sort of that sub pool that's trying to be organized. And at this point, I think it's in the hands of Miriam to make sure that it fits with her vision and what she's been talking with the governor's office about. But if once that's given a green light, TRI will send it out. And it's a nice online form for people to put their interest in, and they'll be able to then, once they've gone through any trainings, they'll be able to be connected to any emergency childcare programs that are up and running. Or if we have enough people not volunteering, but putting themselves out there, it may be to help fill the gap in other childcare programs that need people. So we just don't know what to expect yet.
Dawn?
That's coming.
Can I just get a clarification? My head's spinning, sorry. So
is mine.
I'm
Good
sorry
luck.
you have to explain it 15 times. I'm really sorry. So yesterday on the call with Joan, you were explaining this and she was explaining this, and she said, oh no, schools will not be using this process. It's just for, kind of like these pop-up people or people who are interested in starting their programs and for subs. So now is there a separate link now?
So no, let's clarify that. That's important. So
That's good.
Originally, on the TRI, this form that we were putting together, there was going to be two avenues: people who wanted to start up their emergency childcare program, including schools, and then subs who want to sign up. So that they would go to the same location and sign up. Well, the division decided to go through a slightly different process, and it is, I think, in the end, it becomes more simple for people who are school districts and other organizations that are trying to start up emergency care. If you go to the link that's in the chat box there and click on it, it's a very simple page. It's just like, fill out this stuff, register, make sure you're following these processes in this toolkit, and so that whole facility section of what TRI and folks at ELD were working on got sidelined. So that now exists on that web page. So where Joan was saying, oh, halt, we're not doing that anymore, it went to that web page. So if you go to the web page, that's all about the facilities doing emergency care. And then the emergency sub recruitment is still going through TRI. That'll be up and running hopefully later today, to start mobilizing people next week.
John, I have a question about that, mobilizing people. So the president just passed some laws, and Head Start staff are getting paid. And the concern that was brought to me today in our meeting with the Head Start folks at my backbone agency was is Miriam looking at the legalities of mobilizing or trying to mobilize Head Start staff that are currently getting paid? Because I know they've been working with our attorneys, to make sure that they're doing everything correct during this closure, to make sure they know who's supposed to be paid, what they need to do about those that don't get paid, because not everybody in our agency is Head Start. So there's certain people that aren't going to get paid, and different things. And the concern's been brought up going, well, if we want to decide to open for infant toddler care, we have a list of our own staff to come in and provide that. We don't want our staff confused when this email hits everybody coming from TRI on what they're supposed to do, and if they sign up for it, making sure no laws are being broken, that they're protected. There's just a lot of questions that are coming up, and I told them I don't have an answer for that. Things are changing daily.
So I have thoughts. It doesn't mean that your organization likes my thoughts, but let's see what comes out of my mouth. So people are being paid to sit at home. And yes, your organization may be trying to mobilize them for their own purpose at some point, which I think is an appropriate message for people to know when they're sitting at home. But I think in a time like we're experiencing right now, I would hope that that could be the message, that they sort of need to be aware that they need to kind of come back if they're called upon, because you're their primary employment. But I would hope that there would be a relaxation of sort of the expectation that they not hold multiple jobs or weird things like that, and that if they choose to go actually work during the day for a different organization or a different place that's mobilizing people, that essentially that kind of becomes their hazard pay. They're getting paid double. They're getting paid by you guys to sit there to do nothing, and they're getting paid by this other place to provide a much needed service in the community. And then if you guys said, whoa, hey, we need people in here, they sort of have to be able to respond to that. They'd probably have to leave their emergency care situation. Now, there are going to be organizations that just don't buy what I just said right there. They're just going to say, yeah, no, that's liability. We're paying them to sit there and do nothing. We're telling, you know, they're going to come back at the state and say, you confused everybody and we hate you. But the reality is there's a crap load of people who need support, and it's just going to get worse. And there's a lot of people who have been laid off already and they aren't getting any pay. So, I mean, a little bit of confusion is just going to have to happen, I think, unless you guys have a really good way to help me get a message out that can be super fast, that we can do this differently. I think we're just going to have to manage the confusion, and then Toby, and I'm sure there's plenty of other execs out there that might want to call and give me their mind, but you can tell Maureen to give me a call and tell me what.
She's getting ready to write you an email, so I'm just trying to give you a heads up. But I know our Head Start teachers and FAs have been assigned tasks to do at home while they're off, and she just thinks the wording might be confusing because technically they're not laid off; they're working from home, and doing virtual check-ins with families and sending home assignments to have parents do things. So she had a question, and I shared it, and I wrote word for word yesterday, and they were like, wait a minute, it's gonna be confusing. There's legality issues, blah, blah, blah. And I'm like, they're trying just to make sure that care is happening and those that need care can get people to provide that for these children. So I try to, you know, be on like the same page you are, but it's hard when, you know, we have Head Start family, you know, Head Start teachers, and then their concern was, what about the Head Start teachers that have children of their own? Are they going to get free care because they're working? Or the teachers that get called back? Because we have several partnerships that aren't working and different things, but everybody's doing something small, even if it's minimal hours. They're getting them to do something while they're out. But there was just a lot of questions that I could not answer for her, and I told her I'm still waiting on guidance from that and how can we get this. But she's writing an email, so I'm just forewarning you.
Yeah, no,
I don't know
I
what
appreciate the heads up, and I appreciate that she's concerned. I don't necessarily I don't necessarily think there's a cut and dry way to handle this. I mean, I think there has to be messages to the early childhood professionals at large. We can try and make it as clear as possible. And I will take that, you know, sort of your framing under advisement. But I think in the end, a whole bunch of people are going to try, and well, a whole bunch of people are going to hear whatever we send them or read whatever we send them, and TRI is going to be working with those individuals to get them signed up. And if we have a multitude of sort of Head Start folks that are trying to come to the table to sort of do their job working from home and this, you know, emergency response, I mean, I think we'll deal with it when we get that. We can look at that and go, okay, is this going to be a big deal? What kind of issues do we have to work through? Because just because somebody responds to, I want to sign up for this, doesn't necessarily mean that they get mobilized. So I think there's lots of questions to get through. But on the flip side, I'd much rather piss off Maureen than get to a place where we have actually thousands of unemployed childcare people who would like a wage.
Well, I've been advocating for them to open some of our sites. We have the buildings, the capacity. I've been advocating to, and that's what they're talking about this afternoon, is trying to get some sites up and going for those that need it. But they just wanted definitions on what's emergency, who's priority. How can we guarantee we know their priority? Are we just going to trust they're saying, hey, I'm emergency personnel when they're not? That's just trying to make sure that we're serving the right people if they do decide to open back up. They want to make sure just people aren't coming from a different child care just to come to them to get free care. So that's what they're worried about.
And that's all in the hopper right now. It's all part of the process we're trying to decide. We've had that come up with 211 and emergency calls as well. We only have a half an hour left and there's so much. So I'd really like to get to some of these questions. Like, as I was saying earlier, we may not have answers, but we are moving forward with the FAQs. So I'm glad Maureen's sending that email. That'll help us kind of organize some of those as well. Karen's asking about questions in regards to childcare at no cost for first responders. Brett, I'm wondering if you can help with some of that clarification, specifically around the school piece.
Yeah.
Well, that's Brett before you. So I'm wondering, when we put out information in regards to at no cost for first responders when it comes to the pop-up emergency care, and then when a family is already enrolled in a program that is a first responder and they're paying for that child care. And so what's going to be as far as communication to not have individuals move their children and families from a current care provider because they could get reimbursed through something instead of going to another entity to get free care. So that's kind of where I'm headed on that question.
Sure, good question. I mean, I think first and foremost, and one of the things that we're a little that we need to back up to as the real starting place here is any family that can be keeping their child at home should be doing that. And I realize that everybody recognizes that, but I think we always need to start there. In terms of the situation that you're describing, Karen, I think that based on what we know about what's going to be best for children, that if people have their children in a care setting that is open, operational, their children are safe and being cared for right now, they should not prioritize moving their children. We know that transition is going to be a big deal. In terms of the question around the cost structures here, the starting point for all of this was the public schools. The rationale being from the governor's office, our schools are closed. They are receiving state school fund dollars. People are still being paid while these facilities are closed. We have a way right now to finance both facilities and staff to provide childcare without having to go find another public funding stream. So that's kind of where that started from. Now, in terms of what this looks like for different types of providers who are providing care for either school-age children or children 0 to 5, we know that some of these providers are whether we're talking about after-school programs or whether we're talking about a traditional childcare provider that runs a small business, that there's a fee for service there. We know that some of the after-school programs that could potentially fill in some of the gaps in certain communities work on subcontracts from the school district. So there's all different ways that these things may be financed. We're trying to work this out to make sure that the essential healthcare professionals that need access to care have it, and that cost is not a barrier. I think that to some extent, these these issues are going to be resolved, at least in the very short run, primarily at the local level. I don't think that the way that this is moving forward, we're going to be able to have a single statewide umbrella policy that says, all of this care is provided for free. I think it's really going to depend on what services and supports are in place in communities around the state. That said, we want to make sure that cost is not a barrier to any family, and that nobody's being excluded from care that we need to make sure is getting it. That's what we know for now. We know that this is an issue that needs to get resolved as quickly as possible.
This is Shannon. I wonder if this, because we've had like a couple calls, is there a sheet or a guidance one-pager that, they've gotten a million of them, but one of the things she said is, what would be fair? If I have parents that are leaving care, can I charge them half the rate anyway to hold the slot? She's losing that person. So, I wonder if we can have some sort of guidance, 10 points of how you can negotiate with your parent, or something to that effect. What's fair to work with your families, if that kind of thing? Because I know I've had several people ask that.
Yeah, one of the things that comes to mind immediately for me is, hopefully, I think we can all agree that none of us want to be in this situation for very long, or for any longer that we have to be. So, from a parent standpoint, thinking about when the world gets back to normal, I'm going to want to have that place for my child to go. And if I leave now, it might not be there. So I think that's one lever that providers have, is to say, yeah, look, if I understand you got to do what you got to do, but if you're going to go access this other service, I'm not holding the spot for you for the next 6 weeks, or something like that.
I think
this is a tricky issue.
Go ahead.
That's one thing that comes to mind for me.
There are a couple of things around that. I think part of this is designed, from my understanding, for first responders. How we're defining first responders, emergency first responders, are those who are first in point in being exposed to the virus. So they are most likely exposed to the virus, first touched by it. So those children are too. So how do we minimize the spread of infection and try and keep all of those children in one place? And so this is the thinking, is that they're in one place. When you think about parents wanting to jump to go to the free childcare at the school, it's not really going to be free if their children are exposed and they're bringing it back to them. You see what I'm saying? So that's another thing to kind of think about as we're working on all of this. And I'm wondering, so thinking about the points, as you're asking for, Shannon, the kind of points to talk through for providers. I know Shannon and, Hannah and your group, is it possible you could maybe gather some resources for policy tips and for providers to talk through this? Hannah, would that be a possibility? Maybe we could work on it together. I know we've been asking your team to do like everything, so just wondering if that's in your capacity right now.
I could be, this is Shannon, I could start something and put some things down that I've been kind of hearing, and whether they're great or not, I don't know, but then maybe you can pass it around to directors just to see if there's something else that I'm missing. Give it to Hannah, that kind of thing. You just start something, and
that would be great. Thank you. Hannah, did you want to say something? Go ahead.
I was just going to say, I will connect back with my team and see who has capacity to look through it. My brain at this moment cannot I think we can pull something together. But I will connect with my team to see who can be a point person for it.
Maybe I'll just go ahead and say this out loud, because we have staff that are, that have to work from home, that really experienced staff who have less of a workload now. So if there are certain things that you're interested in farming out, like I'm slammed, but a lot of them are looking for work. So just kind of volunteering some of our folks if you have things you want to hand over.
Awesome. That would be great. Thank you, Taya. That's wonderful. So maybe Shannon, you could send that on to the directors and they could like tap their expertise staff. And then the other thing, and it's kind of getting back to Taya's, your previous question about entering information, enrolling into the database. I want to just say that the TRI team, as they're getting the survey results on those from providers, on those willing to take ECC, they're doing the updating. So you actually could go into NACRAWare now and sort for childcare programs who take infants and toddlers who are willing to have emergency slots open. So you could kind of thinking about partnerships. And then we do have it designed so that if you can see my screen, that as they're getting, the different programs are getting registered in OCC, Office of Child Care. These are also going to TRI, so I think there needs to be kind of a disbursement. So Hannah and your team about maybe some of these going to the CCR&Rs and they can upload this information and enroll them. If like I know in Mary's region, as soon as the YMCA got their programs up and running in the schools, you went ahead and entered it in. So I think if you know programs that are already set up, get them enrolled, get them in and marked at ECC. So just so that's a priority, that and then updating, those are priorities, really know that. I think 211 is getting calls, and really, honestly, the only calls they're getting are essential workers and first responders. Those are the ones who need childcare. Bottom line, we don't have parents who are just going out on a day or, going out and wanting to get away from the kids for the day. That's not happening. Only these two groups are calling asking for childcare. So it's kind of it's what's happening right now. So those emergency childcare settings are the ones that are really going to be needed to be brought up. I would like to make a note with everyone, and so we have been talking about ways, knowing that schools, because they are funded, they're still getting money, they can operate these programs. We're looking at ways to get money to our mixed delivery system who have emergency childcare too. So just so you know, that is definitely something John, Lisa, Brett, and I have been pushing that we want to make sure. So Karen, in answer to your question, we've got to find a way to support the essential workers and emergency first responders who are using a mixed delivery system. That's the parental choice. So we want to find a way to disperse those funds into communities and have a couple thoughts. We've just got to identify it. So it's not off the table. It's definitely out there.
Margie, I have a quick question, Shannon. So I was in a meeting this morning, and it was with several pop-ups, possible pop-ups, but I think one is going to try to start next week. And they're like, oh yeah, we have rock climbing walls and the pool and all these things. And I held them back and I kind of said, I don't want to step on any toes, but how are you going to mitigate the health issue with all of that? Allowing all the kids to, they couldn't really answer to me. That really worries me. And the one thing he did say was, we told staff that if, we're going to do this, and you will be exposed, just know that you will be exposed. And I'm surprised they didn't see my face, but I don't know what to say to that. Yeah.
So I think, I think this is where the guidance here, the toolkit, is an important place to go. It really includes those. So I think as you're working with them, again, through phone consultation and go-to meetings. You know, of course, you're not going to go meet with them face to face. You're guiding them with this toolkit. You guys will know the nuances and understanding of all of this. So I think this
Margie,
is one of your tools. Go ahead, Christine.
Margie, this is Chris. I'm sorry to interrupt, but I just have some really burning questions. Earlier this week, you know, it was my understanding that our staff were supposed to be making phone calls and updating all the childcare that's open and how many slots they have, and our team has been working furiously on that in tandem with TRI, which I completely appreciate right now. And my question is, if we have all these places that are open, are suitable for children, trained teachers who know how to sanitize and keep kids safe, why are we not utilizing them? Why are we not connecting parents to 211 to use that system? Or is there a need at 211 that I don't know about where parents aren't able to find care? I guess that's my question.
That's a really good question. I don't have the answer to that either, except going back to well, okay, let me back up a minute. So we are giving updates, data reports every day to Joan, who takes them to the crisis team, who's working on this every night from 5 to 7:30 or 8 o'clock, something like this. So it includes all the state departments and the governor's office. And we're reporting on the number. Right now, we have over 7,000 slots in our current mixed delivery system willing to take emergency childcare. And that's pretty substantial. So, and there's more because you're updating, so it's happening. So I'm not sure.
I mean, I've got just all morning, I'm getting emails and calls from programs that are telling me some are just having to close because of staffing. So I'm having two ends of the spectrum. One where they don't have staff and they can't come in. The other end is they don't have children coming in. And so budgetary wise, they're having to close. And these are not temporary closures. These could be permanent closures. So there are direct impacts. I know we all know these things, but I want to make sure we're trying as we're making decisions to try to mitigate that.
So I just want to chime in one more time to what Margie had said earlier, and there's literally no super good way to do this, but I do think that we're going to have to figure out how to help programs that are having to close or can't maintain or don't have enough children or enough staff. And I do think there are families that are not sort of part of our first responders group that may need childcare, which I think there's still sort of this need for, 211 to connect the dots between people who are sort of essential personnel, like our grocery store workers, people like that who really still need good childcare options. And it could be on schedules they don't normally work because they're real thin there. So those are where I think we need to mobilize our current childcare, also get them the resources and supports they need. But then this sort of other group of our first responders, like, again, what Margie was saying, like as much as we can, we don't really want them in general childcare because that means what we did is we closed all the schools and then we just changed the placement of where those kids are. They're out now in general childcare, potentially, increasing the issues that are occurring with spreading this virus. And so it's like, we want them to be more contained in places that are not just with general childcare. Because if we just put them in general childcare, we might as well have kept the schools open. This situation is a no-win every angle because we've closed down people's places of work, not just childcare, but everywhere. And economically, it's a mess. So I definitely think we want to maximize on getting sort of the next rung of people in need of childcare still taken care of. And so I think the knowledge of having up-to-date information in those databases, everything you're doing there is perfect. I think the and I think Christine should probably share with everyone, if she hasn't already, the letter that her childcare program, one of the childcare programs in her area, sent out, which was a plea for sort of assistance and help. It's very well written and describes every situation that we're really going to be dealing with the fallout that this is causing economically for these businesses. So I think we don't have all the answers to that yet, but need to be thinking through them and getting the issues that are occurring in front of our leadership and hopefully governor's staff, because it's the question we have to answer after the fact is what do we do now that these businesses closed and are not, not able to pick up and start up again. It's not that simple.
John, this is Mary. Can you hear me?
Yes.
Yes.
Hear you.
It says in that letter that if schools are serving infants and toddlers or younger children, they have to partner with someone with expertise. I mean, are the schools going to be given the information about child care programs in their areas that they could partner with?
I think that's where you come in. Sorry to jump in, John. That's what we're trying to get to all the schools, so they know they call you for those partners, that partnership. They don't know where to go. You're right, Mary. Maybe some of the schools do, but it's going to be haphazard, and I'm sure these programs will say, why are you calling me? So really, you guys are the connecting point, and we're getting that information to all of them.
This is Eva. Can I get a little bit of clarification on the expectation about school districts? We've had some school districts in partnership with many community partners talking about how they want to stand up programs that fill the need for emergency workers, realizing that that is most likely after school hours and weekend hours, and they would prefer to have children going into the current openings because they understand that their current childcare providers in their local communities need those kids there so they can maintain their business. Am I understanding from this conversation that we don't want that to happen and we want them to be in the school and isolated in the school? Or help me understand that, because I've got another phone call at 3 that's going to head the same direction.
So this is, go ahead, Brett.
I wish I hadn't opened my mouth. I'd be happy to let you take this. This is obviously a really challenging question. The way that I've been answering this question throughout the day, because it's come up, is that I think particularly, let's start with the issue of off hours care, because some folks have asked me, are you saying that we should have school buildings running childcare 24/7 to cover all the shifts? And I don't think from a practical standpoint that makes a lot of sense. I think there are other providers that are much better positioned to provide off-hour care than our school facilities, right? So there's that. I think the challenge here that I think we're all dealing with is that the child care need and the public health need are running into a bit of friction with one another. And I think that's what you're getting at, Eva. I have not heard this policy direction around emergency child care as I haven't heard the primary or priority focus being around quarantining children of healthcare workers together. I think that is wanting to make sure that they are that children who are more likely to be exposed to the virus than others, that we are limiting their contact as much as possible. But our primary focus and consideration here is around ensuring that those children have care so that their parents can get to work. And what I've been advising people throughout the day is that the setting in which that takes place may look different from one community to the next. Certainly, we know that schools have a really important role to play, but Margie, John, Lisa, if you're still on, I don't see you. Oh, there you are. Feel free to correct me if I'm wrong, but I think, just from my personal bias and standpoint would be that, where children are already in care and receiving care, that we don't, and they are among these, priority populations in terms of the healthcare workers and other such workers, that we're not trying to move them to another place. But correct me if you think I'm wrong there.
No, you're right. You're right, Brett. Yeah. Unless John has a different opinion.
The only thing that I wanted to add to all of that, which I think is important, is that, if we are really talking about those priority populations of healthcare workers and the fact that they might get mobilized overnights and weekends in a different way than they have currently spent their time doing their work, then their current childcare situations might not be adequate or prepared to do that for them. And so I think the idea that the sub pool thing that we're doing, part of what we're doing is seeing if any of the people who might come forward stating that they're willing to help out, it's not just mobilizing them to do care in these emergency pop-ups or in programs that need additional staff that are already doing childcare. It's also sort of the idea of, will you do care in the emergency responders' home, in those first responders' homes, because they don't want to take their kid to some childcare program and have them spend the middle of the night in a strange place when they could just be sleeping in their home and somebody could be kind of sitting there and providing safe oversight. So I think that's part of what we're trying to do here too. And the reason we're going straight to Oro around that is that we want to make sure that people have some of the higher skills in early childhood. If we're going to actually park them in somebody's home, that we want to make sure that they've got the full criminal background check, not some emergency background check, that they're someone who, when they go in there, are going to be, sort of most prepared. And that's just because we're having first responders then sort of accepting a stranger into their home environment. So, but I think that's just another sort of way that this might get addressed when things kind of get put into action, where those healthcare workers have to really get mobilized in a different way, which I don't think we've gotten to that place yet. But
so we are at time. We've got a lot of your feedback in here. Go ahead, Brett.
Well, I know that Taya's had this question in the chat box for a little while, and we haven't had a chance to get to it yet. Okay. But in regard to, very small school districts, 30 or 40 miles away from a hospital or clinic, if there are, I think right now what would be good is for every school that, for us as, in our roles in the system, to the extent that we have communication with school districts, to advise them to get a plan in place. And part of it is understanding the need in communities. So what we're really trying to do here is match the need with supply. And if there is legitimately not need in a community, then there is no need for a school district to be opening a facility and bringing staff back in. They should be prepared to respond to the call from the governor, because I'm not in meetings with the governor's office, but my understanding, the message that has been communicated is that this is a statewide, all hands on deck. We want to see every district making a response here. So I think there's some prep work that can be done, and if it's determined that it's not necessary, then so be it. But better that than to just sort of blanket say, you know, we don't need that here.
Yeah, I think, thank you, Brett. That's a great, I think originally when we started, I said something along the lines of kind of a community focus and what's needed, and maybe, you know, really having that communication with the school districts and knowing that there are many openings in a region, that could be something that is identified and then understood. It may not be necessary. So, and I think, Taya, you had the chat in there that it sounds like in your region, there's not a call for a lot of emergency childcare or for the first responders needing childcare. It looked that way. So I think that's part of the work in connecting with the school districts, or the school districts connecting with you, is that you're helping kind of navigate some of this. Well, here's what we have. Let me do a search in our childcare database. We have this many ECC taking this age group, so you can help identify some of this even before. And then if there's a high need, it's like, how can we help you set this up, or, you know, work through the toolkit with you, basically, remotely, obviously.
I also just want to say to everybody that I think it's a really great time to connect with their hubs. Our hubs are really usually more in communication with school districts than we are, and with our hospitals, with our healthcare systems. So we've been working with our hub, and they've been gathering some data for us at that level. And that's been, or some, maybe it's not exactly data. They've been talking to the hospitals and the school districts. And so that's been super helpful for us as we navigate these other pieces. And our hub is so ready to figure out how they can best support us. So I'm going to encourage you all to call your hub directors and have a virtual cup of coffee with them and talk.
Thank you, Taya. So we're going to take all of this chat log and take it back to Joan. We want to make sure this, and also it sounds like Brett is working with the program team on setting up FAQs. And we most likely will have an avenue as well where you can send in more questions or comments. And I'll make sure everybody gets this chat log as well. The meeting yesterday, was it just yesterday? We recorded that, and so as soon as it's downloaded into YouTube, you'll get it. And we recorded this one as well, at least when I remembered, which was probably about 10 minutes in. One of the worst. I've got to put a note somewhere, record. So thanks for your time today. I'm hoping that there was some clarity, but the chat log will give us more ways to provide clarity as well. And as you have ideas, that's the other thing, as you have ideas as what you're doing, what you're finding in communities, please send that to us so we can be hearing it.
So Margie, a final plea to be sure that the districts know to contact the R&Rs for lists of providers that can offer care for young children.
Yes, that is the communication that is going out with all of your phone numbers, which, by the way, Nancy, if you could send me yours. You just sent me your name. Thank you.
If you look at the next one after my name, it has both Noemi and I's phone number.
Okay, great. Thank you.
I have
all right.
Very good question. So I imagine ELD staff are maybe working on the weekends too, and that some of this stuff might be coming through on the weekends. We don't typically do that, so even I don't normally. So should we be keeping an eye, you know, Saturday and Sunday with stuff changing so rapidly?
It might be a good idea. I know we just are carrying our phones with us and checking email often. So yeah, we're pretty much on call, but it would be up to you really, Taya. We're trying to provide information as soon as possible. So some things may come over the weekend, but you could still get them on Monday.
I don't want to fall any more
behind.
But okay, cool. Thank you.
Thanks, everyone. Thanks for joining.
Thank you all.
Thanks, everybody.
Bye.